Hello, everybody. How's everybody? Do we get everybody back from lunch? Think everybody's still eating a little bit? Thank you guys all for being here for this panel. Similar to the other one we just did before lunch, I think we're going to just start off in a different tone, talking about the Supreme Court decision related to affirmative action. Dan and Deb, thank you for being willing to discuss this topic. I think it also kind of fits into some of the efforts that you have to advance Black leadership in your own company and throughout the healthcare space. So Dan, if you don't mind, I'll start with you. Did you have a reaction to the news? Obviously, it directly impacts colleges and universities, but many of these colleges and universities produce future leaders.
Yeah, absolutely. First of all, let me say how fortunate I feel to be here. Thank you very much for having me here and to such an important audience and such an important time and topic. Clearly, the Supreme Court decision, as we've discussed in previous session, sets us back in terms of where we need to go in this country in terms of racial equity. It connects directly, I think, with our strategy in two ways. First of all, we rely upon a diverse workforce to come up with the types of cures that we work on every day. And one of the things that we have been working really hard at is trying to increase our diversity in STEM education, and particularly those with biologics, scientific, chemistry degrees. And our worry is, of course, with this ruling is that will take us backwards on that front. But secondarily, in the broader work we do on health equity for our medicines in diseases that disproportionately affect the Black community and underserved communities like HIV and breast cancer, this is just another step back to the socioeconomic underpinnings of the structural biases that exist in our country. And so I believe that Gilead and my voice, and I'm obviously interested in Deb's aspect on this from her perspective. I'm delighted to be here with you, Deb. But we need to speak out on these types of things, and Deb can discuss the amicus brief we issued. We have a very clear strategy at Gilead, right? It's focused on innovation and health equity. And when social issues like this happen, we filter them through our strategy, because it can be very challenging for a CEO in this day and age to determine what to speak out to and what not to speak out on. But as long as we put it through the health equity lens, which is core to our strategy, things like the rights we see going backwards on LGBT plus communities that we serve, things like women's rights, things like this affirmative action ruling, are things that we need to take stands on, and I'm very comfortable doing that on behalf of the company. So.
Yeah, I'll just echo having Dan's allyship at Gilead Sciences is so important because health equity is a core to who we are as a company, and we know there's so many social determinants of health that impact health. Education is certainly one, and we feel strongly as a science-based company that we need diverse team members, broad swaths of people around the table to help us with our innovation. So we did file a amicus brief with some other science and technology companies when the decision was at the Supreme Court. So obviously, it's not surprising, but we're still working with our allies like a legal defense fund to make sure that we stay focused and help to ensure there are other alternatives if we cannot use race. And I'm positive there will be creative opportunities that we'll come up with as a collective organization to help move that along. I started school at the University of Pennsylvania in 1982, and I'm positive I'm a product of affirmative action. So I deeply believe in the idea of taking people who don't have access to the right resources and helping them to have that access. So we look at these issues really closely. We just filed an amicus brief in connection with the Briarwood decision in Texas, where the Fifth Circuit is trying to remove HIV PrEP services as a preventive service. We thought as a company that it was important for Gilead Sciences' voice to be heard because we know how important preventive care for HIV is for the wider community, but more importantly for the Black and brown community that is having greater exposure to HIV.
Dan and Deb, thank you both for being willing to speak about this. I know this was not part of our original agenda, but certainly an important topic for everybody here in this group. That really leads us into one other thing your role as an employer when it comes to health equity, and also just creating opportunities for people of color and the Black community to be part of your company, part of the cures that you mentioned, and part of your leadership team. Can you talk to us, how do you see your role, Dan, obviously as an ally, in that whole cycle?
Yeah, look, it's fundamental. Let me just articulate, for those of you that don't know Gilead, I mean, our key therapeutic areas are HIV and cancer, particularly breast cancer. And just to put that into context, I mean, and many of you may know this, but just to make sure you know that, the incidence of HIV is actually increasing globally, despite the fact that Gilead, for now decades, has invested in a one pill once a day medicine that can take HIV-infected individuals from a death sentence to a chronic manageable disease. And we have a preventive medicine that is effective at preventing HIV transmission. And so when you look at that and you think about the communities we serve, while in this country alone, and we can certainly talk about the African nation and other countries as well, but in this country alone, the Black population is 13% of the population. However, 40% of people living with HIV in this country are Black. 42% of new diagnoses are Black. 2 times people that are being diagnosed with Black are in the southern part of the United States. So there's a real connection, a direct connection with our strategy when we think about our role as an employer. First of all, how can we possibly, and I'm so proud of the colleagues that we have here with us at this conference and throughout our organization, how can we possibly represent those communities if we don't have that type of representation within our ranks? And it starts at the board level for us and for me. It's been extremely important, the leadership team level, and then throughout. Look, let me be clear, our work is not done here. We still have today around 7% of our population at Gilead that is Black. We have goals specifically for 2025 for that to go to 10 and 12%, and importantly in leadership positions. So we need to keep doing that, because how can we possibly serve the communities we serve if we don't have the communities represented within our organization? So it's a business imperative on an employment side. And we have lots of strategies that we're doing. Most importantly, as an ally, I'm listening. I mean, coming into this company 4 years ago, just before the George Floyd murder, having come from a background of living in multiple different countries, but coming back to this country and still seeing the intractable structural issues, I'm listening, we're learning, but we're also applying as we go. So everything from advancing Black leadership mentorship programs within our company, to being a founding member of the 110 initiative that looks at a skills-based approach to hiring instead of the bias that's associated with 4-year college degrees. And we're continuing on that. So it is an absolute imperative. And the last thing I'll say is, because of our ambitions to make this world a healthier place for everyone everywhere, and a lot of companies are afraid to use the cure word. Gilead is a large company, but it's actually a relatively young company. It's only about 35 years young. And it's cured a disease in hepatitis C. I mentioned before what it did for HIV. It's cured a form of blood cancer. And when one is scientifically attacking the most intractable problems, you can't do that with a group of like-minded people sitting at the table. Diversity is fundamental and core to our business imperative of how we come up with these medicines, and equally important, how we come up with strategies for breaking down the stigma and discrimination associated with getting our medicines to the people that need them.
So Deb, over to you. I mean, you obviously are living a lot of this story about Black leadership. You mentioned going to University of Pennsylvania, one of the best schools in the country. Maybe affirmative action got you in the door, but as we can see, your long list of accomplishments, you are a bright and talented person, trying to help other bright and talented people get their opportunities.
No, thank you for that. The way Dan just explained that was why I joined Gilead Sciences about 10 months ago. It is a company focused on innovation, but not only just bringing innovative medicines, but innovative medicines to help the populations that have the highest unmet need. As a daughter of a mother who grew up in Tuskegee, Alabama, one of 10 who receive services from Nurse Rivers, and we all know who she is. I understand there's mistrust in the healthcare system, and we've been mistrustful to people in the Black community. So I use my seat as a place of privilege to make sure we can become more trustworthy, to make sure that we look at other ways of thinking about how do we partner with partners so that we are working with Black-led organizations because they're closer to the community, they have trust with the community. So as a part of my role with the corporate affairs team that's here with me today, we are always innovating as well as with our medicines, but how we show up in the community and what partners we have. So I think that's important for me because of where I sit. And I will say, this is all about economics, and there's a saying in the Black community, you ask someone how they're doing, they say, okay, but I got my health. So we know health is linked to wealth in terms of how we would continue to show up as a people. So I'm so overwhelmed that I can be here and talk about all the great programs we have and how we partner with other organizations, quite frankly, in the US and globally as well. I just had a short discussion with the ambassador, and I was just on a panel celebrating the 20th anniversary of the President's Emergency Plan for AIDS Relief, PEPFAR. And we do a lot of work in Africa as well, on the continent. We fund programs where we can build Black women leaders to help educate them around HIV and the rights with respect to some of the sexual-based violence that they experience. We have a program for men to give them more access to HIV resources. And we know it's only through the public-private partnership, both in the US and outside the US, that we can really get the medicines that are available to the people who need it.
So I really want to talk to you guys about Gilead as an innovator and the role you play with innovation. And Dan mentioned some stats, just mind-blowing stats, unfortunately mind-blowing. 40% of the new HIV infections are in the Black community. When it comes to breast cancer, triple-negative breast cancer, one of the most deadly forms, Black women are twice as likely to get it. Two stats that are very unfortunate and really eye-opening. Deb, I would like to come back to you. Let's talk about Gilead as an innovator. Why is it so important to address these issues? They're two of the biggest areas of your research and development and also your business.
Yeah. Well, as Dan said, ethos is curing diseases, and he mentioned we already started with Hep C. But even when you have these curative medicines, people still are not getting access to it. Right. It's a lack of knowledge, it's a lack of trusting their healthcare provider. So for us, we know we're not going to end the HIV epidemic unless we address stigma in the Black community. And that stigma is a global phrase that you can use in the US, you can use that in Europe. When you talk about migrants in Europe, they generally talk about Africans coming into certain countries. So we know there's a general stigma in terms of getting access to these really life-saving medicines. So it's really important that, again, we kind of collaborate, we innovate around our partnerships to make sure that medicines can reach those who really need it. Right.
So Dan, I want to come to you, and it's important when we talk about innovation. You're also focused on prevention and ending stigma. Gilead investing about $10 million on prevention programs, ending stigma programs. So a very important part of this is we have to make people less ashamed to seek the help that your company and others offer.
Yeah, thanks, Frank. And as I get to what we do in the communities, I just want you to know that, I mean, as we think about stigma and discrimination and health equity, it's not only about the work we do with community partners and funding and enabling them. It also goes back into our scientific labs. And I want to talk about something that I'm just so proud that our company has been doing. But we have a medicine now that is approved for late-stage HIV patients that we're studying now in earlier stage patients and in prevention. And this medicine by our chemists is called a little bit of a unicorn. It's very hard to come by. It's been 16 years in the making. But you know, it's a once every 6-month subcutaneous injection. The reason I bring that up in terms of how we talk about person-centered innovation is because much of the stigma associated with taking a pill, and we've learned this from the communities we serve, it really can stop an individual from preventing a disease or from appropriately managing their disease. And discretion is really important, as we know, in so many communities. So the ability to, and access to healthcare systems, but the ability to think about, the way we kind of like to think about it is like a twice-a-year vaccine that could prevent HIV from you ever getting HIV, and you know, alleviating so many of the barriers in our communities, particularly our Black and brown communities in the South, and Africa, cisgender women, and elsewhere where there's just so much stigma associated with taking medicine and seeing a healthcare provider. So I want you to know that you know, innovation for us means coming up with the right solution that not only addresses the medical illness, but also addresses the fundamental structural barriers for people to take medicines. Because frankly, if everybody, you know, took a medicine today, there would be no HIV, because we have a medicine that prevents it and a medicine that treats it. And when you treat it, you create a situation where people can't pass the disease on either, because if you're undetectable, you're untransmissible. But obviously, it's not enough. So we need this type of innovation on the medicine side. And then back to the community work side, it resonates with what the previous panel said. I mean, we invest significantly, of course, capital, but the capital is one piece of it. So for instance, we have $100 million over a 10-year investment in communities in the South for structural barriers to HIV. And we do that not through national organizations, as was said before, but really through local organizations. One of the ones that I'm very connected with is the funding we do through the Wake Forest School of Divinity, working with faith-based organizations. And it's a learning curve I've been on because, as many of us know, I mean, the church is not necessarily the first place that one would go to talk about HIV. And yet, leveraging enlightenment through the School of Divinity and through pastors and ministers in the trust circle of Black communities in the South, and being able to get over that barrier of, you know, if you like, you know, sexual orientation, but getting to rather caring for other individuals and health more so than sexual orientation. There's been huge breakthroughs, and we're going to try to leverage this community of faith-based organizations as well for things like cancer screening for Black women. This shocking statistic of 2 times, most aggressive form of breast cancer, triple-negative breast cancer, is 2 times more prevalent in the Black community, and a Black woman is 28% more likely to die than their white counterpart from the disease. So it's really, really important that we work. Of course, we put our capital to work, and we do a lot of that in this country and also in other countries around the world. But finding the right organizations, and it is not just about funding, it's also about bringing our expertise, but obviously listening to them on what we can do in the communities to make that successful.
So we're talking about some of these stats that are, you know, disappointing, shocking in some bit. Can we just give, is there any progress, any positivity we can put on this story? Obviously, people getting HIV is terrible, but are you seeing progress when it comes to ending the stigma? Are you seeing progress when it comes to prevention in different communities, especially Black and brown communities?
Well, we're spending a lot of time trying to support that, frankly. And we, as Dan mentioned, we have this Compass program where we're into year 5 over a 10-year period where we're putting $100 million into training advocates to kind of help foster those conversations. So we know that it's not easy. It's a historical issue. Certainly, we're focused on the South because that's where we think there's a greater incidence of HIV increasing. But I will say it's hard as we have new policy that comes out of Washington is not easy. You know, getting access to good health care is becoming increasingly difficult, particularly for women. So there's a lot of work we're doing on the ground, but also in DC as we try to foster and argue for more policies that would make fighting stigma and getting medicines to people easier. So we're kind of looking at it from both approaches, working with communities, but also working with our partners in DC.
And I would just say, definitely our community partners are making progress. You know, that number of 42% new diagnoses in the Black community arguably would be higher without the type of work that our community folks are doing. I'll just give you one example. I was down at Jackson Memorial Hospital in Miami a couple of weeks ago, and We have programs that work with hospital systems, community health organizations that test to treat linkage to care in unhoused communities, in all different types of communities. And it's very clear, we measure progress of our community partners. It's very clear that in those communities where we have tests to treat, you know, emergency room admissions, health community centers, that when you can treat somebody immediately or get somebody on prevention who's HIV negative, you see the rates of HIV infection going down in those communities. So to Deb's point, while we have counter forces working either politically or policy-wise, we definitely see progress with our partners in communities where we have programs, and we have more work to do. Same thing in Eastern Europe with the crisis in Ukraine and what we're doing through the Elton John AIDS Foundation and the work in Eastern Europe. So progress is being made and more work needs to be done.
I think it's important to highlight one of the things you're talking about. Deb, you mentioned the $100 million you're spending. It's also with more than 400 partners on the local level.
Absolutely.
You mentioned the other panel, not just throwing money at the problem, but connecting and cooperating with people. So can either one of you, can you talk more about that? Your role as a collaborator. Obviously, you know, you want leadership in your company that represents the communities you want to serve, and then you want to innovate with your medicine, but also just working with these different groups on a local level. How important is that? And are there any strategies or techniques that you're using that you think can elevate some of the things that other companies like yours are doing?
No, I'm going to say a few words, and I'm going to let my CEO,
Please,
because he's good. I will say
good
this.
on
No, this is really important for us. And again, to the whole innovation, I just have to give a shout out to Rashad, who's a VP in our organization, and his title is Vice President for Advancing Health and Black Equity. I don't know too many Fortune 100 companies that have someone of Rashad's caliber to really help drive and co-create solutions, you know, innovative solutions in terms of how we attack the problem with HIV. So I think we're setting up the right leadership within the company under Dan's leadership for us to really focus in a way that really makes sense. But I'm going to let Dan also jump in here.
I think you nailed it, and I'm so proud of the team that we have, and we continue to learn and organize around that. But it's important to note that, I mean, you know, Rashad, in his position before this, ran a group of, in this country, community liaisons. So just as a lot of you probably think of us having sales forces or medical forces out there educating on our biopharma products. We equally have a nationwide force that's specifically dedicated to working with communities, and they're in the local communities in which they serve. So they are embedded in a way that allows them to connect with their other colleagues at the company and bring the right solution at the right time to support a community organization. The other thing we do is we spread news on things that are working. There's a lot of experimentation going out there, thankfully, but when something works, whether it's a test to treat strategy, like I said, we become then the enablers to allow and empower other community organizations to take some of the ideas and run with it. So while clearly we defer to the community organizations for their knowledge of the community, we can bring real expertise around what's going to give them the most leverage and how we're going to work with that. And so our role as a collaborator is always a two-way street, and we're always learning from each other. But we're also very results-oriented. I'll just be clear. I mean, you know, there are organizations that we fund that may not have the success that we think we're going to have, and we want to make sure we're obviously supporting them and engaging with them, but also directing our capital to those that are going to have the biggest success.
You know, that's a really important point. Sometimes there's good intentions, there's funding, but you don't see the results. So there's a lot of people here that lead nonprofits and lead some of the organizations you may fund. Are there any best practices that maybe they need to keep in mind to put the funding and the expertise that you're bringing to best use?
I think we take a co-create lens because, again, they know what's happening in their community. So we want to hear from them. So, for instance, we just announced, I'm so proud, we just announced a $10 million grant focused on Black women and girls around HIV. Thank you. Really excited about that. And we just opened it up for the grant process, and I think someplace online. But we really want to hear solutions from the folks on the ground. How do we talk to Black women and girls about HIV? We don't talk about it. We don't think it applies to us. So we want to open up the lens to see what's possible.
Right.
So that's kind of the approach we take. And as Dan said, we then leverage the best of what we're hearing in terms of rolling out a program, and then we obviously try to measure the impact that we're having.
Yeah, I think co-creation and collaboration seems to be a theme that we might hear a lot about today. Can we get you guys to give us a key takeaway? So much to talk about when it comes to triple-negative breast cancer, HIV. Is there a key takeaway that you want the audience to have?
Yeah, let me say my call to action is really around the stigma associated with HIV. I think we have to own that as a community and do better. I know there's December 1st is World AIDS Day, so I invite you to work with your partners around that. February 7th is National Black HIV Day. Again, I think there's some opportunities within your organizations to do a call out, to have some programming, because we really have to own that and try to make sure that we get prevention, because as Dan said, you don't have to, HIV is not a death sentence, but we have to get access to those who really need it.
I'll double down on that. And the other thing I'll add in my responsibility in the company is I want you to hold me accountable. I want my team to hold me accountable for Are you doing that?
Yeah.
Okay. Should I just?
No.
But I know you do every day. But also you should hold other people in positions of leadership accountable. We're beholden to a lot of stakeholders, none more important than the community that sits in this room here, particularly in the diseases that we work on. So just as I said, we hold our community partners accountable, you should hold us accountable for the fact that we are a good steward of economic enterprise, global Black economic enterprise, but also that we do the right things, not only to run a sustainable business, but to make sure we're investing and making real progress in health and Black equity.
Thank you both for your time, your insight, and your transparency. These are difficult topics to discuss. Thanks for sharing the strategies that you use and some of the efforts that you're making. So, Deb Tellman,
All right.
EVP of Corporate Affairs at Gilead Sciences, Daniel O'Day, CEO of Gilead Sciences. Thank you both.
Thank you.